Hi, I am Dr. Nalin Malhotra. I am the Chief Medical Superintendent and Joint Director in the University Health Centre of OP Jindal Global University. I did my first part of the education, that is graduation and MBBS from Delhi University, and I did my further training in the United Kingdom. I am licensed to practice both in India and United Kingdom, and I am registered with both the regulatory councils of these countries. When I joined this university during the peak COVID time, we did learn a few lessons because of the pandemic, and now we have expanded our university health center to the standards of that matching of any other center in any international university in the world. In India, if we say, no university would boast of the kind of infrastructure and the services that we offer in our health center, and we are always expanding and working hard to ensure the safety and health concerns of the students are properly addressed in the university campus. So our health center now consists of approximately 40 beds, and we cater to both emergency and the OPD requirements of not just students but also the faculty and admin staff of the university. That is around a population of around 15 to 20,000, and these people depend on us as their primary healthcare provider, and we try to fulfill all their required needs in terms of extending emergency medical services as well as having specialist consultations in-house and the regular OPD services that run 24 hours in the health center. In the University Health Center, we have around 22 doctors, and we have around a nursing staff of 70, and we have 5 admins who extend the emergency administrative services as well in the University Health Center. Yes, we have a specialist visiting almost every day, in fact 2 or 3 specialists visiting sometimes on some days of the week in association with many hospitals in Sonipat, but particularly Tulip Hospital. We also have tie-up with Max Shalimar Bagh as our primary tertiary care center for referring students who require higher care and might not be stabilized in the services available in Sonipat. So I am proud to tell you that the health center operates 24 hours. We are one of the only centers in the country that provides 24-hour OPD services. In all other hospitals, including AIIMS, the OPD services are not extended beyond the night hours, but in our university health center, we have 24-hour OPD services, and of course, the emergency services are also available 24 hours. We have a fleet strength of around 8 ambulances, which are also available 24 hours for picking up and responding to any emergency patient, and we also have a deployment of minimum 5 to 6 doctors at any given point in the health center, sometimes even more. So emergency is one of the most important points that we have focused on in recent years, because the initial few hours or initial few minutes for that matter are the most critical period during which, if a patient is stabilized and emergency care is provided, there is a great improvement in the chances of that patient surviving and the quality of recovery. So we have a fleet strength of 8 ambulances, like I just said, and those ambulances are not just ambulances, but they are ACLS and BLS equipped ambulances that have important life-saving equipments like AEDs, ventilators, and many other devices which are usually not found in the ambulance services that are even extended by many multi-specialty hospitals. Other than that, each ambulance is now manned by at least 2 trained emergency medical technicians or paramedic staff that, in addition to the ambulance driver, extend the medical service at the patient pickup itself till the time the patient is brought to the health center. We also have a dedicated area of emergency that we have recently opened and operationalized, which consists of 8 dedicated beds that are ICU standard and are manned by trauma nurses or critical care nurses, as well as a dedicated team of 2 doctors that tackle and care for only the emergency patients. So first aid kits are available at all the hostels as well as different departments of the universities. We also extend them through the EOs to different laboratories like that of various departments and schools to tackle any emergency or a short requirement that they might face. In addition to that, we also have deployment of around 15 AEDs all across the campus. So AEDs, for those who don't know, are the life-saving devices which are are a mandation in developed nations, and they are placed at all public places. I am proud to tell you that we are the only university in the country that has this high deployment of AEDs all across the campus, and there is an improvement of around 100% in chances of survival of a patient if AED is used for that patient in the initial 5 to 10 minutes of a heart attack or a cardiac arrest. So we regularly send out advisories via the health center official email, which are prepared by doctors in association with various NGOs that spread this message of different preventive measures that a student, or for that matter anybody, can take in order to have a better immunity and a better ability to prevent an illness from setting itself. Yes, we do believe that prevention is better than cure, and hence we regularly also conduct workshops in association with various school councils and student councils of different schools, and we teach them not only life-saving skills like BLS, that is basic life skills, and ADUs, but we also have workshops in association with MACs and other hospitals with various specialists coming in and educating them about important topics like breast cancer, cervical cancer, and other things which require awareness at the right time, that is the young age. So mental health is one of the most important concerns that is thankfully now gaining importance in not only our country but all across the globe. In association with the CWCS department, that is the Center for Wellness and Counseling Services, we cater to the mental health needs of the patients. CWCS department has a team of dedicated counselors that cater not only to regular counseling sessions but also mental health emergencies that present to them, and we work in close association with them and help the students with their mental health needs.
Hi, I'm Dr. Nidhi Shukla. I've been here from last 3 years in the OP Jindal Health Centre. I have done my MBBS from Maharani Lakshmibai Medical College, Jhansi, Uttar Pradesh, and I've also done my Masters in Public Health from Emory University, Atlanta, USA. I have also done a couple of fellowships pertaining to trauma and emergency care. And also I'm a certified doctor in maternal and child health. I've had an experience of around 12 to 13 years working in different multi-speciality hospitals across Delhi NCR region and also in Uttar Pradesh. The experience here has been really great, working with the students and the young, young population of India. It's been really great, and it's a completely different experience as compared to working in the hospital. So they have different sets of problems. It's been sometimes challenging also because it comes up with we are focusing more on counseling the patients because they're obviously students. We have to tell them their do's and don'ts. So it's been really challenging, but it has been great. There has been a lot of learning as well. Secondly, we have in the recent semester, we have had made a lot of changes in the health center. We have added emergency. There's a completely different unit of emergency department. We have increased the number of beds. We have obviously increased the manpower. We have a lot of doctors working here, a lot of nurses working here. So we have a huge team of nurses, doctors, and nursing assistants. We have a huge fleet of ambulances which helps us in bringing the patients or dealing with their emergencies in a very time constrained manner. So as a head of this health center in OP Jindal University, I think we are very, very much prepared as compared to the other universities in taking care of the healthcare needs of the students. Definitely this health center is fully equipped to take care of your children here, and you are in safe hands at the health center of OP Jindal University.
OP Jindal Global University Health Centre is one of its kind in the entire country. We now have facilities and services available for students that are equivalent to that of a multi-specialty hospital itself in the campus. We have a team of around 22 doctors, 70 plus nurses and paramedic staff, a fleet of 8 ambulances, a dedicated emergency response coordination center, and a wireless network to ensure all emergencies are catered to in real time and in minimum maximum arrival rate. We ensure that students and their health needs are taken care of and are prioritized over anything else. Every single student to us is important, and we ensure that their health needs are answered and responded to effectively as well as in time.